Hi, I'm Gabriel. I'm back. Yes, like JD mentioned, I am a person living with myalgic encephalomyelitis, chronic fatigue syndrome, with fibromyalgia, and also HIV, all complex chronic conditions. And I had COVID recently for the first time. So I'm part of the study that we mentioned before. You will get information on that study and how to join it if you have had COVID for the first time in the past 4 weeks and are HIV positive. And that really got me thinking about how do we care for each other at home. And so that's what my present, and while we're ill, and that's what my presentation is going to be about. I'll share my screen. Okay, so managing illness at home and how to prepare ourselves. So this is just general suggestions and anecdotes. By no means you should take it as medical advice or in place of medical advice. Always consult your physicians or licensed healthcare provider to make the right choices for you regarding your health. Remember that you know your body best, and particularly when it involves taking any prescription or over-the-counter medications, right? Like Dr. Peluso said, if you can, get vaccinated. I do invite all of us to treat with kindness those who are not vaccinated for whatever reason. Some people cannot, some people don't want to. How do we hold them with compassion? And if they get sick, we don't blame them and are there to support them. So I believe that we should talk to our doctors or medical professionals ahead of time. I did, and it was very helpful because I saw a friend of mine get COVID for the first time over a holiday weekend, and it was really difficult to access treatment. And he's a long-term survivor, so he really needed that Paxlovid, and eventually got it from a neighbor, but that was just complete luck. So talk to your doctor ahead of time. The measures that are in place at this point are not sufficient. One-way masking is less effective than if we were all wearing masks. So it seems inevitable that at some point we might get COVID, we might get the flu. The season has officially started. And we could be at risk of getting Mpox. So discuss your treatment options with your doctor and discuss the side effects, also interactions with any of the medications that you might be taking. See how easy it is to get in contact with them or how to get in contact with them when you develop symptoms, what to do over a holiday weekend, where do you go to get tested, and when is the best time to get tested, right? For Mpox, for instance, I'm not quite clear yet as to when one should get tested, etc. But we'll try to send information on that. And additionally, should your doctor not be available, or if you don't have a doctor who's responsive, locate the nearest urgent care facility or emergency room. That's helpful. Have their phone numbers always handy and know their hours of operation. Also, find out if there are any hotlines or local health department phone numbers or service agencies that can help you get access to treatment and vaccines, free testing, and also know their hours of operations, and particularly during holidays and weekends. You don't want to be left out in the cold over a long weekend. So stock up on the basics for conservative treatment at home. That would be something to reduce fever and treat pain. Ibuprofen or acetaminophen are recommended. Those can be covered by some insurance plans if they're prescribed by your doctor. They're also not that expensive. It's harder to plan on whether you'll need antihistamine or decongestants, cough syrup, or cough drops, but it's good to make a list, or depending on your symptoms, and identify a person. And we're going to talk about identifying people in our lives that can actually help us when we are sick. But these are some of the things that are good to have. They're not very expensive. If you live in a city like New York, where you can have everything delivered, then that makes it much easier. But if you live in other areas where it's harder to have things delivered, it's better to stock up on these things. I can tell you from experience, Paxlovid leaves a really bad taste in the mouth consistently while you're taking it. So cough drops for me were a lifesaver. I didn't have a cough while I had COVID, but I needed the cough drops to just eliminate that bad taste from Paxlovid. Have a thermometer and a pulse oximeter just in case. They're always good to have. And again, ask your doctor about the potential treatments in case you get COVID-19, in case you get the flu, or in case you get Mpox, or MPV. That's what we've been using, because that's the last webinar I attended. That's how they were referring to it. But if Mpox is the thing of the day, well, ask your doctor about what to do just in case, and what the interactions are with any remedies, natural remedies, or over-the-counter medications that you're taking, as well as your prescription medications. I know that, for instance, Paxlovid for COVID-19 has a lot of interactions with very common medications, such as statins for cholesterol. The duration and severity of symptoms vary from person to person, so it's good to have a short-term and a long-term plan, even for, especially for the required isolation periods. I, for instance, experienced the Paxlovid rebound, and my rebound wasn't like President Biden's, which allegedly had no symptoms. I was undeniably sick. I was very symptomatic when I rebounded. So I had 2 separate isolation periods. I was sick for over 2 weeks, and I did not plan on that. So I was very congested. I ordered my decongestant for 7 days, and then I rebounded and I had to do it all over again. So have plan A and plan B in case you can't have things delivered and you need someone to assist you with going to the pharmacy and getting those things for you. That takes us to building relationships with people and identify those people who can give us, for instance, help us with delivery, getting us things, basics like groceries, hot meals, maybe medications. If your pharmacy doesn't deliver, maybe they can pick up. You can assign a person for pickup for your prescriptions. And moral support is really important, right? If you get a PCR test, if you're getting tested for Mpox and you have to wait for results, or if you just have a suspicion that you may be sick, who can you talk to? Who can you turn to? Who's a good listener? Who can listen to you and support you morally while you're going through, and emotionally while you're going through these waiting periods, and also through the isolation periods. And so it's time for pod mapping. I translated it into Spanish as cápsula because it's like a capsule, for health. So this pod mapping worksheet was created by Mia Mingus for the Bay Area Transformative Justice Collective. They use it for transformative justice support, but we're adapting it to health. And when you get the slides as a follow-up email, you'll be, the links will be live and you'll be able to download this sheet that you can see here so that you can map your own pod. Mia Mingus, just very quickly, is an educator, a trainer, a writer for transformative justice and disability justice. She's brilliant. She's a queer, physically disabled Korean woman, transracial and transnational adoptee raised in the Caribbean. There will be a live link to her blog, and there's a photo of her in black and white. She's a Korean woman smiling in the picture with long hair and glasses, and she's sitting on a wooden chair with plants and trees around her. So back to pod mapping. This is what the pod map looks like when it's empty. And what you're going to do is first, from a strengths perspective, you're going to post these questions for yourself, right? What are the people in my pod good at? Like people whom I have good relationships with. What are they good at, right? I may have a best friend that is not the best at responding at emergencies. For instance, for me, in my emergency contacts, it's very important that one of them at least speaks Spanish. My family's in Mexico and not all of them speak English. So it's very important for me to have somebody in my pod who speaks Spanish and can get in contact with them if something happens to me and I'm not able to talk to them. You can ask yourself who responds well to emergencies. Not everybody deals with emergencies well, right? You can ask, who can I ask for help, right? And excuse my brain fog, it affects me more since I have had COVID. And you can ask, who's a good listener in my life? Same thing for you. Who can I help? Who can I reach out to and have these conversations about giving and receiving care? Who can I be a good listener for? Who can I provide moral support for? And when they're sick, have these conversations. When I'm sick, can you help me? And what are you willing to do for me? So, and when you are sick, how can I help you? And what am I willing to do for others? These are important things to think about because living and getting sick, it's going to happen sooner or later for all of us, unfortunately. So when you're mapping your pod, this is you at the center in the gray circle. And in the circles that are bolded right around you, those are the closest people to you. These are the people in your pod, the people that you will go to have these conversations, to ask these questions directly, right? How can I help you? How can you help me? How can we be of support to each other? Mia Mingus points out that in her work, they found that most people have very few people in their pod, maybe one or two. It's not uncommon to have few people in your pod. The point is to identify them. You are encouraged to put names in the circles so that it's really clear for you, and that you grow relationships so that you can nurture relationships so that you can have more people in your pod in those bolded circles. Next are people in the dotted circles. These are movable people. These are people who you know, who you have a certain level of trust, and they can do things for you. You can do things for them, but maybe they're not as close to you, but in a pinch, you can reach out and they might surprise you that they may be willing to do more than you thought. It's always good to give people the opportunity to be different. That includes us. Give them the grace and give ourselves the grace that we would give others. And when somebody wants to help and offers help, let them, if they want to help you, because that is sometimes a difficult thing to do. It's sometimes easier to help others. And last but not least, you identify in the big circles on the very outside communities, networks, or groups that you can reach out to for help, right? That includes informal groups of people or agencies that provide you with services, or like I said, your doctors could be here, or healthcare providers. And that was it for my presentation. Thank you very much. I'm going to stop sharing my screen and pass it on to JD.
Thank you, Gabriel.